Primarily, especially male pattern hair loss, is mostly genetic. And so that's what we see in the practice. And also in women too. Genetics plays an important role. Now, it doesn't just come from the mom side. You do get some genes from the other side too.
What can somebody do to kind of get ahead of it?
Today, if you take action early, you may never ever need a hair transplant. We say time equals follicles. And what we mean by that is that if you are susceptible to hair loss or you have a hair loss problem going on, over time, it's going to get worse. It's going to progress without treatment. So it's a chronic and progressive condition, typically.
All right, and welcome back to the Fortitude podcast. I'm your host, Micah, and my significant other here is my partner in crime is not here. She's in her she's in the time of her pregnancy where she was recommended not to fly, so that's why I'm here. But I am so excited for this podcast because I have the one and only Dr. Bauman, who is a board-certified hair restoration surgeon, going on 30 years in hair, and he happens to be my hair transplant doctor, as you can see, did a phenomenal job. And so I'm excited to talk with you and share with people about hair loss, what causes it. We'll go into what causes it, different hair restoration, things that you can do to prevent it, things that you can do to bring it back, and so on. And so I'm really looking forward to this.
Well, thanks so much for having me, Micah. This is great.
Of course. So why don't we just get started with, how did you get into hair this specifically? Like, did you originally, were you like a plastic surgeon? Like, what's your story of how you came to like specialize in hair specifically?
Yeah, so I don't think anybody wakes up and decides they want to be a hair transplant surgeon right out of the gate, and certainly I didn't. My first interest was plastic surgery. I was mentored by a plastic surgeon literally before I could drive a car. And he mentored me all the way through, even when I was in high school and college, and eventually went to medical school. And I had the opportunity to see plastic surgery through his eyes, literally looking over his shoulder while he was performing those procedures.
Wow.
But even through my internship and residency in surgery, I never saw a hair transplant. And I had no real interest in hair transplant at that time until I had met a hair transplant patient. And so this patient that I had met was undergoing something else cosmetic, probably an eyelid procedure or something like that. But I noticed in his medical history, he had talked about his hair transplant. So I'm looking, trying to figure out, where did he have his hair transplanted on his head? And it looked amazing, like his hair looked great. So we had this brief conversation about what he perceived as the research that he did to get to where he had a beautiful hair transplant result. And he was so excited that he fooled me that that I couldn't tell that it was a transplant. He shared with me the whole story.
Yeah.
Single follicle implantation and where he went and the surgeon that he went to and so forth. And I guess I was the type of person and even type of surgeon that thought hair transplants at that time in the mid-1990s were going to be like pluggy and probably painful and maybe not looking right and why even bother? And so his results struck me like sideways basically, and I didn't really know what to make of it at that moment.
I mean, correct me if I'm wrong, but there was kind of a stigma behind hair transplants back in the day where it seemed like you pick up a doll and they have like these plugs and it looks a little ridiculous, but it's definitely not the case.
Right. So plugs were very common in the 80s and even in the early 90s. Those were large punch grafts of hair. And so he didn't have that. He had a very natural look. And so he explained to me the artistry and the precision that was used and why he chose the surgeon he did. And so I start to think to myself, hey, maybe I should look into this. I'm interested in cosmetic procedures and reconstructive surgery. Maybe I could learn something about hair transplants.
Yeah.
The other thing that he imparted to me that I remember vividly was how it changed his life.
Really?
So socially and professionally, he said his life was completely different after he got his hair restored. Opportunities abounded, not only in the social areas, met his wife and so forth, but also in business. So, I mean, that really stuck with me. And so as I learned more about hair transplant surgery, looking into first textbooks and then journal articles, then going to conferences, and eventually traveling around the world, really looking at surgeons who were doing the procedures, I learned that there was a lot of technology and a lot of artistry. And the more that I learned about it, the more I liked it. And eventually I did a preceptorship fellowship program in New York and basically said goodbye to my plastic surgery dreams and hello to hair transplant surgery. And I never looked back. I went full tilt into hair transplant at that time.
Yeah. I mean, your place here, I remember coming here, what was it, 2 years ago, I think, for the first time. Mm-hmm. And I was just blown away by your setup, by the technology, by I mean, just everything that you got going on. And it does it really seems like you guys have truly specified in, and specifically in hair and hair restoration, and not just hair up here, but like you were telling me about how you've done eyebrow transplants and eyelash transplants and
Yes.
beard transplants as well.
So beard restorations.
Wow.
That was the last time I spoke to Howard Stern, actually, as he was asking me about beard transplants.
Okay.
And so that was an interesting interview.
I bet.
But hopefully we don't go that direction
Sure,
with this one.
sure.
Eyelash transplants, one of my favorite procedures to do.
Yeah.
I learned that from a Brazilian plastic surgeon, also back in the 1990s, actually, when it was just kind of a quirky thing at a live surgery workshop, and there was nobody in the room, and I was just fascinated. I wanted to be able to do that procedure.
Yeah.
And,
I mean, that was amazing to me.
And of course, eyebrows, back in the day in the 1980s, eyebrows were thin and wispy. And, today it's like the Kardashian effect,
Sure.
So
Yeah,
there's
yeah.
a lot of need for those folks who have overplucked or have been suffering from thyroid
sure.
disorder, things like that, have, even age that disrupts the eyebrow shape.
Do they not grow back if you pluck them?
If you pluck them too much, too often,
Really?
they do not grow back, just like your existing hair.
Oh.
Yeah.
I
That's
did
a
not know-
traction alopecia problem.
Where
essentially.
where does the hair come from to do hair, like eyebrow and eyelash?
So eyebrow and eyelash transplants come from the scalp, and that's why they come with scissors. Because they do grow long.
Yeah.
So be prepared.
Okay, got it. That's amazing. So, kind of going for the people that maybe haven't dove as much as the person like me, but like, what causes hair loss exactly? Is it genetic? Does it come from the mom's side? Like, I don't know if it's a wives' tale or if it's actually true, but I've heard that it's your mom's dad. But then my mom's dad, he died at 92, 93. He had a full head of hair. So that's where I was like, okay, all of my brothers, all of us have really receding hairlines, balding. It doesn't look like it because of the job that he did, but like very, very recessive genes. So is it genetic, and I guess what causes it?
Well, so the hair follicle, which is its job is to produce the hair fiber that we see,
Okay.
is a very highly metabolic organ. And you have 150,000 of them you're born with on the top of your scalp. And so there's a lot of things that can dysregulate the function of the hair follicle. Everything from nutrition in your diet, to medications, to aging, to stress, to circulation in your scalp, to inflammation there. But primarily, especially male pattern hair loss, is mostly genetic. And so that's what we see in the practice. And also in women too. Genetics plays an important role. Now, it doesn't just come from the mom's side. You do get some genes from the other side too.
My mom will be good to hear about this.
Yeah. So
she was like, I'm the reason.
no, it can come from both sides of the family. And
Okay.
actually, sometimes we do genetic testing to see what are the metabolic pathways that influence hair and hair loss, and what kind of medications or treatments you might be better off responding to. But it can come from either or both sides of the family. So looking at your family tree, your blood relatives or siblings can tell you a lot about your, future hair.
Right. So so for the person that does go down, like they see that pattern and they're like, okay, this is happening in my family. This is probably going to happen to me. What can somebody do to kind of get ahead of it so that they're not having to, maybe work backwards? It's
Sure.
like, could they get ahead of it? Is there ways that people can do?
Well, the good news is that today, if you take action early, you may never ever need a hair transplant
Oh,
or
wow.
something more invasive. So there's a lot of ways to get on top of it. We say time equals follicles. And what we mean by that is that if you are susceptible to hair loss or you have a hair loss problem going on, you can certainly, over time, it's going to get worse. It's going to progress without treatment. So it's a chronic and progressive condition, typically, especially genetic male or female pattern hair loss gets worse if you're not treating it. So getting on top of things early is really, really important. The issue is that you can lose a lot of hair before it's noticeable to the naked eye. So in men, we see the receding hairline, the thinning in the crown. By the time you see your crown shining through, that area of the scalp has already lost about 50% of its hair.
Oh, wow.
So if someone is noticing that you're looking thin, you're already a little bit behind.
Wow.
And that's why the measurements are so important. So early action, meaning intervention, a diagnosis, and evaluation is a critical step.
Okay. And you guys do that.
Absolutely. So
Yeah.
part of what we do at Bauman Medical is do a complete and thorough evaluation. This may mean looking with the microscope, different areas of the scalp, the more permanent zones that are not going to be affected by hormones over time, and compare that to other locations like the front or the crown or even in the temple areas. We'll do density measurements with an AI-powered microscope. We can do hair bundle cross-sectional trichometry, which is basically like making a scientific ponytail and measuring it in different areas. We can go back to those same zones repeatedly over time to see if there's a progression of loss or if there's some stabilization or improvement from therapy.
I don't know if you know the answer to this, but why is it for men specifically, the male pattern baldness, why is it where it's like, it's here, the receding, it's the crown, and it's up top, but this typically doesn't? Is that like a biological
Well, what's the
thing?
purpose of that? So we think we know exactly what the
Sure.
purpose is. Obviously, the reason that the back and the sides of the scalp is permanent is because those are the areas that are resistant to your body's hormones. And that's something we may get into later in terms of therapies and treatments.
Okay.
The hormones that trigger or miniaturize the trigger the miniaturization of the hair is something that continues on, starts at puberty and can continue on your whole life. The speed at which that goes on is genetic. So some people have a slow progressive hair loss that doesn't become visible until they're 50s, 60s, or 70s. And other folks can go bald by the time they're 25 or 30.
Yeah, that was my route.
So why did Mother Nature make us that way?
Yeah.
Well, I have some ideas about that. I think personally, it's like a clock that is evident from across the room. So if you're let's say a caveman and a cave woman, you've got to make a snap decision in terms of evolution if there's a good mate there for you to propagate the species. And so if you have a way to immediately determine whether that person is either childbearing or able to procreate, that would be a good thing to see under the campfire, so to speak.
Oh.
And so if you have some kind of time clock that shows that you're aging, then you're not necessarily as good of a candidate for that procreation category.
Sure.
So evolutionarily,
Did it have to be so unattractive? Like, why did it have to be that? Couldn't it be like the sides or something? I don't know. I'm just
well, you'll have to ask Mother Nature about that one, why it's like that. But you have a dim campfire light. You've got to make a snap decision, Micah.
Yeah, there's a tiger over there, and you're about to be eaten. But so I guess that makes sense. Yeah.
So to propagate the species, and I think that's when you have a thick, full, healthy head of hair, you look in the mirror, you look good, you feel good about yourself,
right?
You feel youthful. And, of course, on the flip side, and as you know, as a hair loss patient, when the hair starts to change, there's emotions that are attached to that. Hair is a very emotional organ.
It was my biggest insecurity, and still is to a degree. I think that's always something that I'm constantly, conscious of. And it's interesting because I have friends and I have other people that, and they don't think about it because they don't suffer from hair loss. Maybe they have something else that they think about a lot, but it's just interesting where I was like, I notice how other people are. I'll see like a 50-year-old or a 60-year-old that has a full head of hair. I'm like, man, you got good genetics, or like, man, I'm so jealous of that. And other people don't notice that, but I do because I've been balding since 18 years old.
Or they have a good hair doctor?
Yeah, potentially. Okay. Yeah, exactly. For sure. But yeah, it was probably that one actually. But I definitely noticed for myself being super insecure about that, just my confidence level. And I am in the performing, I went to school for acting, went to school for performing. And I've even had people and teachers say that, hey, you're probably not going to be a leading man because of your hair.
Wow.
And
that's harsh. Wow. That's unbelievable.
It's harsh, and it might be true, but it was kind of like a hard reality of wow, it doesn't matter if I'm better than this other person. If I don't look a certain way, then I'm not going to get the role. And that was hard to hear, and that took kind of took a toll on me. And so it definitely shifted just in my confidence, to be able to do that for myself. And I know that Sarah's happy about it too. She loves me either way. Guys, don't get into that. But she definitely was like, wow, I can't. It's crazy to see the befores of what I used to look like. I don't even remember that person. It's kind of wild. So you talked about men and women. There's a difference between the type of balding, right? That happens, because I know it's very common in men, but it does happen for women as well, right?
Absolutely. So nearly 40% of our patients are women.
Oh,
But
wow. Almost 50.
Yeah. Female pattern hair loss looks different. So genetically, it's called the same thing. Androgenetic alopecia is the name for male pattern baldness, and female pattern hair loss. It's a sensitivity to those hormones over time in a specific area. But women don't go bald like men go bald. Usually they'll lose diffuse amounts of hair in the frontal zone, and they'll notice a widening part line. They may notice less volume in those areas, less coverage of the scalp. They may notice their ponytail volume shrinking. They may notice more shedding in the shower, that type of thing.
Yeah.
And it's not till many years later on, perhaps, that they see a little bit of a recession of the hairline.
Okay.
Sometimes it happens later on in life. So, yes, there are hormonal conditions like polycystic ovarian syndrome, PCOS, that happens in women of childbearing age where you can see some hair loss. Some women notice it around the time of hormonal shifts, like with childbirth. So we need to be prepared for that.
Postpartum, I've heard of
Postpartum
that.
hair loss,
Yeah,
yes.
right.
And then around menopause. So perimenopause, menopause, postmenopausal women have severe changes in their hormone status, and their hairs can be affected by all of that. So very often women will come in with a change in their hair texture or hair volume, and they want to know what's going on. So that's when we initiate the measurements.
Sure.
So we can see a baseline and then track that over time. And there may be some simple non-invasive things to keep the hairs growing thicker, stronger, better if there's just a weakening effect. But, women also undergo much more facial plastic surgery than men do. So very often a brow lift procedure or facelift procedure, whether it's in midlife or later, can leave someone with scarring or change in their hairline. Many women come in with a high hairline to begin with, and they don't like that shape.
Sure.
And so we can use hair transplantation to restore that as well.
Wow.
And as we mentioned before, eyebrows, eyelashes, even sideburns after plastic surgery. Sometimes the plastic surgeons kind of forget to leave you with a sideburn, or the sideburn ends up behind your ear.
Oh.
Sometimes that happens.
Sure.
But we can replace those areas too for women. So
Wow.
it's very, very common. But I think taking that holistic approach for women is even more important perhaps sometimes than men, because there's so many different things that can affect female hair loss more than just the genetics. So
Sure.
dealing with, for example, restrictive diets or the new Ozempic craze with
Yeah.
the GLP-1 agonists and
Really?
diet.
That's been causing hair loss as well.
It's an epidemic, yeah, for
Wow.
sure. And everybody remembers the COVID and COVID lockdowns and vaccinations, and all that can wreak havoc on your hair. We treated over 1,000 COVID-related hair loss patients.
Really? Wow. So for women that are they know they're going to go into postpartum, are there what hair restoration options would you recommend for people to prevent men? So if they see the lineage and kind of the trend in their family, what are some things that they can do now or is there like certain treatments or certain medicines or ointments or whatever? Like what would you?
Yeah. So that what we're asking about is like the algorithm. What's the process of investigation? Yeah. So for example, if it's a young man who is let's say between his schooling years and is really thinking about hair loss, he's got some hair loss in the family. There's a lot that we can start off with. So good nutrition, really important. Making sure his scalp health is on point, that there's no inflammation, dandruff, seborrheic dermatitis, or things like that are dysregulating the follicle function.
Right.
Let's take a look at his lifestyle. Is it a toxic lifestyle? Is he getting enough sleep? Is he eating right? So simple things like nutrition and hair care and scalp hygiene are kind of the foundational things that we do first.
Okay.
And then the next level up could be non-invasive treatments that are non-chemical, like things you do at home, red light therapy, low-level laser light, or regenerative treatments that are non-chemical in the office, like PRP, platelet-rich plasma, could be done. So for busy college students, very often they're coming in over the summer for their PRP treatments to help maintain their hair, because that's kind of a set it and forget it type of therapy. They're probably not going to be using the laser cap in their dorm room, so
Sure.
these young college kids are doing that. They may use medications. So medications like minoxidil or finasteride may be part of a male pattern hair loss treatment program.
Yeah.
And so-
And would you say there isn't kind of like a, hey, everybody does this? It's like, it's so individualized based off of their kind of needs?
It's very individualized. Obviously, if there's aggressive male pattern hair loss going on, then we're going to employ a variety of modalities to attack the problem. There's no one miracle cure.
Right.
And sometimes patients know they may be adverse to taking medications. They just don't want to. And so, let's try things that are non-medical. Let's do the PRP. We've got transepidermal delivery of growth factors and peptides that we do in the office now. That's a non-pharmaceutical treatment. Red light therapy, as I mentioned before, FDA cleared for hair regrowth. So there's a lot of things that we can do in the early stages that can avoid the medications, but also if they've got serious hair loss, we've got to start throwing a lot of layers of treatment on board.
For those who don't know, can you just describe what PRP is? Like, what is PRP?
Yeah, PRP is platelet-rich plasma, and that's really the cornerstone of regenerative medicine in hair restoration. It's also been used in orthopedics and in wound healing for many, many years, at least 2 decades.
Okay.
We've done over 13,000 PRP treatments. Oh. PRP basically is an hour out of your day. We take a small blood sample, and we separate out the platelet layer, and we concentrate that platelet-rich plasma into a very specific concentration of platelets to achieve the effect at the scalp. Local anesthetic goes into the scalp, so it's a painless process. You're not going to feel the PRP going in. PRP is deployed through the areas of concern, and you're shampooed and washed and out the door.
Wow.
So that night you might feel that your scalp is very numb and maybe looks a little bit pink, but that's a process that's going to deliver the growth factors inside the platelets into the scalp to trigger hair regrowth.
Yeah, that's amazing. I know that they use that for like wound healing as well, or specific wound healing.
Absolutely.
It's kind of like the same kind of one.
You can use PRP for a surface wound to help it heal faster. A lot of professional athletes who have an injury in a joint, like a knee or shoulder, will get PRP treatment as a cell therapy treatment to help rejuvenate, repair that injury.
Yeah. And I know that, like, so what was it? A year ago, I did PRP, and I did. Are you guys kind of specific to the PDO grow? Is that like you guys kind of invented that?
Yes. So what you're referring to is PDO, polydioxanone. Those are threads. It's a synthetic material that goes into the skin. So these are tiny little filaments that we can deploy into the scalp. They absorb over time. They're deployed painlessly, obviously, while the scalp is completely numb, and that enhances the results of the PRP, giving you an extended and more powerful hair regrowth.
Wow. How did you come upon that?
Well, I can't say I invented it. That's for sure.
Okay.
I was at a conference many years ago, and someone asked me, hey, have you ever tried polydioxanone threads for the scalp, for hair? And I was familiar with them through cosmetic procedures and treatments. A lot of them are used in the skin of the face for wrinkle reduction and for skin tightening and things like that. And a lot of people doing it for cellulite and such. But I never heard of anything regarding PDO and the scalp and hair. So they said that they had heard about it through some of their colleagues in South Korea and also in India. And I did a little bit of research, looked into it, and sure enough, there was a few published papers on the process. We acquired some threads, and we tried out some friends and family first, and I was amazed. The first 12 patients we did it on had amazing response. This was just the threads alone, not even with PRP.
With PRP, okay.
And we deployed them into the different areas of hair loss, female with receding hairline, male pattern baldness areas, and every single patient had improvements in hair check measurements, so those are the measurements that we do, and had visible regrowth. Not a new hair, but the weaker hair is growing stronger.
Okay.
So
is there ever... So I think this was something that I was wondering too. When a follicle dies or and goes away, is there a treatment other than hair transplants that can revive a follicle, or is it when it's gone, it's gone?
Yeah, when it's beyond repair, so it reaches a certain point. Remember that over time, the hair follicle is going to miniaturize and produce a shorter, thinner, weaker, less pigmented hair over time. So each growth cycle, it's going to shed out the nice hair, and the next one that grows in is not an oak tree, but a birch. And the next one that grows in is more like a shrub, and the next one that grows in is more like a blade of grass. And then eventually, you just get this really, really tiny, unpigmented hair like the ones that you have on your cheek that you can't see.
Yeah.
Not going to be good for coverage.
Right.
So once you get beyond a certain point, basically it's a certain thickness and length, it's beyond repair, or at least it's considered beyond repair.
Sure.
Theoretically, there's still stem cells there, but we don't have any treatment to revive that hair follicle once it's beyond that point. So that's why time equals follicles, right? So you want to hit it before it gets to that beyond a point of no return.
Is there no stem cell so you say that there's stem cells that are in it. This is a question that I'm wondering is now there's stem cell therapy, that you can do for muscles and stuff. Is there one for hair?
So I think what you're asking about, is there hair follicle cloning?
Yes.
Or hair follicle multiplication. Well,
Okay,
we don't
I
have
have
that.
heard about-
We don't have that technology yet.
Okay.
But there are many researchers around the world that have been trying to figure this out for decades.
Really?
Yeah. So stem cell therapy for hair that's available now is not the multiplication process.
Okay.
But it's more in the form of like exosomes, which are stem cell signals that we
Okay.
use in the scalp. So that's available. And even PRP in some way is considered a cell therapy because platelets are cell fragments. And so we're using that as treatment, right? But we're not recreating a new hair. The
Because
holy
I got exosomes last
right.
year as well.
You did.
So can you just talk a little bit about exosomes?
We can. Don't you want
no?
to hear about hair cloning?
I do. I do.
Okay, we can save that for the end.
Okay, great.
Because right now we don't have hair cloning yet.
Okay.
But we do have a way to prepare you for hair cloning.
Okay.
And that's hair follicle stem cell banking. So the researchers don't have hair cloning yet, but we want, if we have available somewhere in the future, hair follicle cloning, we want to use the youngest possible cells. So like when I'm 70 and I need a hair cloning treatment, I don't want to use my 70-year-old hair follicles.
Right.
I want to use my 53-year-old hair follicles. And that's why last year I banked my stem cells. So that's a process that can be done during a hair transplant or just a quick visit in the office with a couple of plucked hairs.
Really?
Yeah. And that will send that biologic material, those cells will be sent to a tissue bank, cryopreserved for the long run, literally forever.
That's amazing.
You just got to pay the subscription fee.
I think sure. I didn't because so now that we're about to have a baby, we're going to bank
The cord blood.
The cord blood.
Same idea.
Yeah, stem cells. So it's the same idea with hair.
Yeah.
And so if you do it, so ideally, if somebody really wanted to do this and had the means to do it, they would do it at what, 21, 22, like at a young age, so that they have young, healthy hair.
Correct. Yeah, you would do it at the earliest possible time.
Sure.
I would assume post-puberty, but
And then,
yeah.
oh sure, and then you would bank it away, and then once they figure out how to do this, then they can literally clone your hairs and just put
That's
it in
the hope.
without taking. Is that the idea?
Correct. Because the way hair transplants are done today, we're not creating or destroying any hair. We're taking the individual follicle one at a time from the backyard and putting it in the front yard, and that's it. So you're missing it here and gaining it there.
Right.
Right. But theoretically, hair follicle multiplication or hair cloning would give us some unlimited supply of hair follicles eventually.
Wow.
So the hope is that years down the road we'll have that. But so I want to meet that opportunity
For sure.
starting now with
Yeah.
my youngest possible cells.
Yeah, that makes sense.
So.
That's incredible.
There's some other interesting things that are happening too.
Because that was a question I had, was like, are there any like innovations that are like in the works or that haven't come out yet but are kind of like being discovered and experimented on? And so you would say that's kind of like the biggest one.
Yes,
right now?
and so that's the long-term plan
Yeah.
with the banked cells. But in the medium term, you can take those cells, take a portion of them, and expand them in the laboratory. And from that treatment, this is where we're going to get into exosomes. We can get exosomes, which are stem cell signals, from those cells, and then those can be delivered back to us in the clinic for deployment in your scalp.
Okay.
So that is new. We're just going to be getting started with a pilot study on that. But exosome therapy has been around for a number of years. Exosomes are the little packets that come from stem cells, and those are created in a lab. And it's an acellular treatment, meaning you've got a stem cell line in a laboratory, mesenchymal stem cells, which are the kind that you want. They give off certain signals. Those signals are then collected and purified, quantified, sterilized, concentrated, cryopreserved, and then sent to us in a little vial.
Wow.
So that's what you had.
Yeah, yeah.
But those were messages from the stem cells that were in the bank,
Okay.
but not the hair follicle stem cells that we could get. So
Okay.
eventually,
So
if we take your own
Yeah.
hair follicle stem cells, we send them to the bank, we can create your own autologous exosomes. So exosomes that come from you, from your own cells. So that's what's coming soon.
Got it. So that's the thing that's kind of around the corner. That's the next thing.
Correct.
That's really exciting.
Yeah.
Because I've had this thought. I'm like, will there ever be a cure for baldness, or like male pattern baldness or hair loss in general, where like somebody will figure out, oh, you just take this thing and then it'll never happen? And like, is that a possibility, or is it just biological and the best thing that we can do is to try to prolong it or not prolong the hair loss, but like prolong the inevitable What am I trying to say? Delay.
Yeah,
Thank
delay.
you.
Right.
Delay
So
it.
to prevent the future hair loss
Right.
requires early intervention that we talked about. So whether it's pharmaceutical
Right.
or photoceutical, like a laser, or regenerative treatments, or growth factors and peptides, those actions are helpful.
Yeah.
Over time, patients may need a hair transplantation, but the idea is to start those other therapies early enough so that you can delay the need for transplants or reduce the size and the amount of transplants that you need in the long run.
Yeah.
That's like the whole goal of what we do.
Totally.
That's it.
Totally. So this is something you want to do for the rest of your life. Are you still excited? You've been you're going on 28 years, going on 30. Are you still as excited about it as you were?
Oh, 100%. In fact, I'm even more excited today because there's so many new therapies and treatments that we have.
And I get that from you every time we've had conversations, because I'm really into biohacking too. I love that stuff, and so we kind of go back and forth. But you seem always excited about the innovations and knowing more, and I think that excites me and gives me confidence to come to you when I was going to get my hair transplant, because you want to go to somebody that's excited about what they're doing and wanting to always better themselves and better their treatments. So that's really exciting. And when it comes to, because the hair transplant itself, the transplanted hair is permanent. Right?
Correct. So
once
it's
that
relatively
happens.
permanent, right? We know there's other things. God forbid you need
Sure.
medication for cancer and things
Right.
like that, or you're stuck on a desert island, you're dying of starvation. I mean, your hair follicles are going to be sacrificed.
Right.
But they're going to be, from the back of the scalp to the front, they're immune to the male pattern balding process. So they're immune to your body's hormones, which is the DHT, dihydrotestosterone, which is created in your body from testosterone. So a lot of our treatments, the idea is to reduce the DHT either at the level of the scalp or systemically in the body to protect the hair follicles.
Right.
But you're absolutely right. The transplanted hair is relatively permanent, but your other hair is not. So that's why you need ongoing work. Yeah, ongoing therapy to protect.
To protect, yes, that's right. And we're coming up on the end here, but for the hair transplants themselves. So for me, my first hair transplant that I got in 2014, they did a strip. And so I'm kind of left with the scar, which it was what it was, that, I guess, where we went. It still ended up producing a good looking head, but now I can't really shave it down.
It worked. It worked. So
just
the early days of the old plugs, those plugs grew,
Yeah.
and then we progressed to linear harvesting or strip excision. That's what you had. I've did
Yes.
thousands of those procedures in my training back in the 1990s and early 2000s. But at that moment, we were pushing and pioneering to try to get to minimally invasive work. So
where you're not left with a scar.
We don't have to take a strip of scalp anymore.
Right.
And that's where we are today with FUE. That's the new technology. That's what you had.
Yep.
And that's what enables us to move as little as a single hair follicle at a time, or to go after beard follicles if we need that to replenish, or even body hair to put on the scalp. Mm-hmm.
So if you're, let's say your donor area, which is here, is maybe, is starting to thin out, where if you continue to take, it's going to look, thin. You can take from other areas like beard, hair, or chest hair and stuff.
Correct. If let's say your challenge you've had,
as long as it matches, I guess, the color.
Well, that's always, there's some risk and benefit there, right? So if you are donor depleted, let's say you've had multiple procedures or old style work that's been done, you've got some scar tissue back there, there's less and less hair to take and still look okay.
Okay.
Right? Cosmetically, we don't want to create a defect over here while we're fixing this one over here. So we can use beard follicles for that. And that's an amazing source of extra donor hair. For many people, it's the lifeboat off the Titanic for the hair loss situation.
Really?
So yeah, I mean, it's an amazing amazing procedure to do for those folks that have been told, oh, you can't have any more hair transplants. Well, you can't have any more the old-fashioned way, but we can do FUE out of the beard.
Wow.
Yeah. But so you asked about the color.
Is it a different texture?
Yeah. So here's the asterisk on that.
Sure.
Yeah. The footnote is that beard follicles are a little bit different typically than your scalp. Now, not always, but sometimes they're a different color.
Yeah.
They're a little bit more coarse. The hair that's produced is a little bit more wiry, so maybe more difficult to control or style. But the hair is a little bit thicker. So there could be some nice benefits there. If you have a
Sure.
little bit of a curlier, coarser hair, especially for the crown zone, that actually helps you in terms of coverage. It's not a hindrance.
Sure.
And if you pepper those in,
Yeah, I guess as long as it's not the front line.
right. So the very, very few patients have a perfect match that their beard can be used for their hairline,
Sure,
I would
sure.
say. We do have a few of those in the practice, but they are few and far between.
Wow. So yeah, that makes sense. Like it would probably blend super well, like in the crown or the back area where you wouldn't really notice, like when it's within the rest of your hair.
Correct. And as long as we're talking about rescue operations, if you're truly out of donor hair, then we can use things like SMP, scalp micropigmentation, which is basically like a medical grade tattoo process, just a little bit more micro in terms of the tip that's used. The depth is much more superficial than a regular tattoo. And the ink is not tattoo ink, but it's something carbon-based that looks like a hair. So when they do that, they put little tiny dots on the scalp, and it basically gives the impression of trimmed hair. And so you see less scalp shining through.
See.
So that can be good for scar, because the scar is oftentimes very reflective of light, even if you put hair back in, beard or other things to fill it in. Sometimes we use SMP to cover scar.
Like you could do that for my old hair transplant
Yes,
scar.
it is. Yes.
Oh, wow. So is that like you can use that for how long does that typically last? Like the pigment?
So great question. So unlike a hair transplant into that zone, which would be permanent, the SMP does fade with time. And so wherever we're using that ink, and you don't want the ink to be lasting forever. You certainly don't want tattoo ink to turn blue and all that business.
Right.
So that's why this specialized gray or carbon-based ink is designed to fade with time. So you definitely need to redo it. It could be 5 years or 7 years. Everybody's a little bit different. If you have a lot of sun exposure on that area, you might need it more sooner rather than later. And how you take care of it, obviously, and take care of your health and your scalp is important too.
Yeah.
But yeah, that's a nice little rescue operation. Also, that's good for coverage and camouflage.
I know. I wish I would have been able to have the FUE instead of the scar, so I wouldn't lift the scar. But because you guys don't even do the strip anymore. You only do FUEs.
I have not taken a strip harvest in probably 17 years or more.
Yeah, and that you do 2 different FUEs. Is that right or no? There's one that's shaven and there's one that's long hair. Is that correct?
So there's a couple of different ways to perform FUE.
Okay.
And so if you're trying to get the largest amount of grafts out of the scalp in really the least amount of time, most efficiently, then you're going to undergo a wide shave, which means basically we shave the donor zone. We don't have to shave the top. So often you see that on TikTok and social media.
Yeah.
We never shave the top, really, for any kind of procedure. But for larger sessions, we do shave around the sides and the back. And if you've had previous transplants back there, obviously that would reveal your old scarring potentially.
Sure.
So there is some issue there. If you want to keep your hairstyle the same, we can do, as you said, a non-shave or no-shave long hair transplant. So we leave the hair long length. We can extract the follicles without trimming the hair.
Wow.
It takes a little bit longer. It's a little bit more of a meticulous process, and it's a little bit more costly, but the benefit is that you can return to your regular routine without looking like you joined the Army.
Sure. Yeah. Where like that real a deep fade or
Exactly.
or
High
tight
fade.
fade.
Yeah,
high fade. I believe that's what we're going to be doing tomorrow, right?
Correct.
For me, that's exciting. Yeah, we're gonna do some touching up and some filling. So I'm excited for that. So now, after tomorrow, I will have had 3 different kinds of hair transplants. I'll have had the strip, I've had the FUE where it is shaven, and then the FUE, which is the no shave. So that's cool. I guess what's next is cloning for me, which is exciting.
Yeah, well, we should bank some of your hair follicles tomorrow, and so that you're prepped and ready for that. So we could do that.
I'm sorry. I know I'm going back, but that's fascinating to me. So they could clone the hairs as many as the idea is that once this process has come out, they would be able to take a 1 or 2 hair follicles and clone them as many times as they need to.
That would be the ultimate goal.
Sure.
Yeah. I mean, that's the holy grail, right? So there's, 1,000 researchers in the world that are working on that.
Once
that's not there yet. This is not something that's available, right?
Yeah.
It's a little bit more fictional than functional at the moment. But
if that were to happen, would hair transplants basically just go away?
No, because theoretically they would deliver the follicles and we'd have to put them in. We just wouldn't have to do an extraction.
You just wouldn't do the FUE, like the extractions.
Correct.
That makes sense.
So, we can use our creativity to say, well, how many follicles do you want tomorrow? So we would order 1,000, 2,000, 3,000, and they would clone them. I don't know, maybe it would take a couple of weeks, and then they ship them to us, maybe overnight them, and then we implant them.
Wow.
I mean, that's how I envision it to work.
That's amazing
who
for
knows?
you guys too, though, because then it's way less, time and effort to do the extraction, because that whole process it takes a long time.
Correct. And now it would still require a meticulous amount of artistry,
of
because
course,
the angle,
to
the
do
orientation, the position
sure.
is, as you know, is so critical in getting the hair transplant to look correct.
Yeah, that's something like that I learned the last time for that we had the hair transplant, of how, because it's not as simple as just like boop, 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 boop. It's like knowing where my hairs are going, so that you made it so that the hairs will match exactly the angles that my other hairs are going, as opposed to just being like, oh, I'm just going to plug them like in like this. It is kind of an art to it.
No, it's 90% art. A lot of people think planting hairs is like planting a seed. Well, when you plant a seed, Mother Nature knows to grow it straight up. Hair follicle never, ever grows straight up from anywhere in your body. It always grows on an angle. And the reason for that is because Mother Nature's trying to deliver some kind of coverage in that zone. That's the reason why you have hair, to protect your scalp.
Yeah.
As well as to make you look youthful and great, obviously, of course. But, every area of your scalp has a different angle, orientation, and position, and the follicles need to follow that specific pattern in order to blend in with what you have, and also so it looks normal and natural and not like, crazy.
Right.
Yeah. So there was a recent research study that was published that showed that a certain type of sugar, this deoxyribose, improved hair growth. And it made news around the world, as a lot of hair growth studies do.
Yeah.
But the fine print is that it was on mice. So, and this is something that's quite common, actually, that you have a hair growth study done in mice, but we don't have any proof or evidence that it works in humans.
Sure.
But, dozens and dozens of people sent me that article over the course of the few days after it kind of made its round around the world in all the media. So, of course, I ordered some. And
Sure.
But it's not a medication. It's actually comes from a chemical manufacturer, this deoxyribose, and it's like a little white powder in a jar.
Really?
It was not super cheap either. It was quite expensive for the amount that I got.
Yeah.
But obviously, there's nothing we can really do with it at this moment, because we don't know the exact mixture. And since it's not a pharmaceutical, it can't be made into like a compounding drug, so to speak. It can't be compounded for you in with, your minoxidil or whatever that
Right.
you're using. And so we would probably have to get a cosmetic chemist to try to put it together to make it into some kind of therapy
So that's
or
kind of like
treatment.
early trial stages.
I would say even preclinical, because this is just, some basic biology where they were doing some wound healing studies on mice, and they saw that it grew hair, which is actually quite common, actually. Things that help with wound healing very often have an impact on the close cousin, the hair follicle.
I'm sure you're like the first person that people like send you stuff as soon as like a new thing comes along.
100%. 100%. It happens. Absolutely. Anything that hits the news, you can bet I'm going to get like 10 or 12 text messages before the surgery starts.
Yeah, I think
They
I
all
saw
wanna know
like
about
something
it.
on Instagram. It was like from a tree sap. It was like it was on like Memesar or something like that, and it was like potentially found the cure for hair loss from this tree sap, and I was and then I never heard from it again. So
I guess when we see those things pop up in the media, it's always like, well, stay tuned.
For sure.
We got to take it a little bit further. But I had a patient today.
It's got to go through many different trials, right? Before it even gets to the place where it's like, okay, now we can start to do this.
Absolutely. And just as an example, this, obviously this sugar has been available, it's off patent, there's no proprietary stuff that could be, gleaned from it. So you're not going to have a big pharmaceutical company try to invest and figure out $1 million clinical trial to prove that this sugar is going to grow any hair.
Right.
Because there's no juice to squeeze out of that lemon, so to speak. This is more of a generic type of thing that's just out there. It's not going to work.
That makes sense.
So we're never going to, it would take somebody like me to kind of try it on the different patients, once we figure out a formulation.
Right. And I guess you have to find people that are willing to try it. Yeah. Right. That won't be me, but if somebody else wants to.
Yeah. A sweet new cure for hair growth. That's right. How it is, with the sugars.
Well, as we wind down, if somebody were to, I guess, could you just walk through what your guys' process is? Like if somebody were to come to you, get evaluated and like want to go through the process of restoration or get checked out to know like what's the best way? Like, what does that look like for you guys?
I mean, as you know, we're just footsteps away from my 13,000, soon to be 13,000 square foot hair hospital, essentially. So that's the mothership, as we say, where you get all your detailed evaluations, the AI microscopes and things like that. But nearly 50% of our patients connect with us first virtually. So from your home or phone, you can go to baumanmedical.com and click on the link that leads you to schedule a consultation. And so that consultation process requires you to fill out a little bit of information. So I want to know a little bit about your hair history and your medical history. You're going to submit some photos for this evaluation process. And we're going to go through from beginning to end exactly where your hair loss situation is and what you're trying to accomplish. And so oftentimes that'll start with a 30 to 40 minute conversation online. And then if you can, come in and we'll get a more detailed evaluation.
Yeah. So they don't have to be right in Florida. Like it can start at their home, like on Zoom first
absolutely.
To get that evaluation. And then from there, go from there. And it doesn't mean like they could come in and it might not mean that they have to get a hair transplant. It could be other options
Correct.
that you guys provide, right?
Correct. So that the holistic or comprehensive approach looks at everything from lifestyle, as we said, to scalp hygiene and all of that. I mean, I have a department that's specifically detailed and geared up for just taking care of the health of your scalp. That's headed by my trichologist, Kim, the scalp whisperer. So she handles all of that. And then, what else can we do before you need some degree of transplantation? There's so many things that we talked about to engage in. But yeah, a huge number of patients come in from out of town. Obviously, we're shortlisted on many, many different lists around the world as one of the top clinics.
That's how I found you. When I was doing major research into, when I wanted to look into this, I'm like, I want to go to somebody who's going to be one of the best, if not the best, and want to make. And when I looked up best hair transplant doctors, like in the world, in the U.S., all this stuff, you were on almost every single list. And so I was like, okay, there's something here. So you guys know what you're doing, and like being a patient of you and coming here, it definitely shows up with just the amount of just the service that you guys provide and the level of professionality. And what I felt too is very confident throughout the whole process, because you were very, you would just explain as things are happening and as we were about to go into the next step, you would just explain every single step so that I was never in the dark about anything. And so I just appreciated that.
Well, no problem. I mean, that's going to keep your anxiety level low. Yeah. It's going to keep you informed of what's going to happen. You know exactly every step of the way what's going to go on.
Yeah.
That's the secret to success right there.
Absolutely. Absolutely. Well, thank you so much. I appreciate you coming on the pod. I think this is going to bring a lot of value to a lot of people. I know if you're like me and you struggle with hair loss, or if it's in the family, it's better to get ahead of it than not. Or if not, then there are things out there that you can do. And so definitely check out Dr. Bauman. How should people like look into you, or what like socials, or how do people get in touch with you?
The best way to connect with the practice is through the website. There's literally thousands of pages of information at baumanmedical.com, BAUMAN medical.com. And you can even just ask a question. You go to baumanmedical.com/ask, and it's a free form. You just ask any question you've got about hair loss. You can click on the links there to schedule an evaluation, whether it's virtual, from, as we say, from your home or phone, or in person right here at the clinic in Boca Raton, Florida. But wherever you're at in your hair restoration journey, we're here to help you. I look forward to doing that.
That's awesome. Well, thanks, Dr. Bauman. Appreciate it. And I'm sorry you're not getting off the hook. Every single podcast that we've done, we've ended by singing goodbye. And it's only 2 notes. You don't have to sing.
I'm like sweating already.
Yeah, it's like, you're going to have to just pick the notes, okay?
All right.
As always, we like to end our podcast by saying goodbye. Yes, that was great. Honestly, that was probably our best goodbye that we've done. Like, it actually sounded as good as. But thank you, Dr. Bauman. Appreciate it.